Okay, so just a little introduction. This voice thread is going to discuss Hashimoto's thyroiditis, specifically the presenting signs and symptoms and their causes, if known. So Hashimoto's thyroiditis is also known as chronic lymphocytic thyroiditis. It's the number one cause of hypothyroidism in areas that have sufficient iodine levels. It's an autoimmune disorder that causes thyroid failure due to the destruction of the thyroid gland. Its etiology is not completely known at this time. Okay, so this is a case study about Hashimoto's thyroiditis. So basically this 38-year-old female attorney reported for her yearly physical exam complaining of tiredness, difficulty concentrating on her work, and a noticeable decline in her memory over the past several months. She attributed many of these symptoms to severe stress that was generated by her legal caseload. And after further questioning, it was revealed that she had been constipated over the last 6 months, and she was having difficulty avoiding gaining weight, and despite warm weather, she felt chilled without a light sweater. The only medication she was on currently is an oral contraceptive. Her physical exam revealed a well-proportioned woman, 65 inches tall, weighing 125 pounds. She also had sparse eyebrows, particularly in the lateral margins, and diffusely moderately enlarged thyroid gland with a prominent lobe above the isthmus. So her laboratory values were relatively normal. Her T4 total was 5.5. Her T4 free was 0.25, which is a little low, and her TSH was elevated at 22. Her anti-thyroglobulin antibodies were positive, and her antimicrosomal antibodies were also positive. They did a fine needle aspiration of the lobes that revealed lymphocytes, plasma cells, and cohesive clusters of enlarged follicular cells with nucleoli and abundant eosinophilic granular cytoplasm, also known as Hürthle cells. The patient was placed on medication and was asked to come in for a follow-up. So I will be basically providing information on the signs and symptoms of Hashimoto's thyroiditis and if there's any cause known for those signs or symptoms. So my first article is a case study of a woman with Hashimoto's thyroiditis. It will list the signs and symptoms as well as the causes of these symptoms. Just a little background, this case study presents a 25-year-old female named LD. She presents with a 5-year history of increasing fatigue and depression. This past year, LD suffered a social history of her parents divorcing, her mother being admitted for severe depression, and her sister also being admitted for a life-threatening anorexia nervosa. All these other symptoms include severe muscle pain in both arms that has been going on for 2 years, brain fog, sleep disturbance, heavy painful menstrual cycles with premenstrual headaches and birth pain, exertional wheezing, recurrent infections, especially sinusitis and sore throat. She also had bruising and gingivitis, symptoms of hypoglycemia, and long-standing digestive problems. She complains of many months of bloating with abdominal pain after eating and pain during the night with diarrhea over the past 2 weeks. Her physical exam was normal besides her presenting as pale and listless. Her blood test and coagulation profile were within normal limits except for a low ferritin level and a high IgG. They did an endoscopy and a duodenal biopsy, which were normal, and they also did a hair tissue mineral analysis that showed high levels of copper and low levels of zinc. So these TSH levels were within normal limits. However, her anti-thyroid peroxidase antibodies were extremely high, and her anti-thyroglobulin antibodies were slightly elevated. Okay, so this slide is going to list her symptoms and what was done to help alleviate them. So her digestive symptoms, bloating, fatigue, and brain fog were all resolved by avoiding gluten, even though the gastroenterologist that she saw stated that the test did not show that she had a gluten intolerance. Her other symptoms were treated by supplementing with various vitamins and minerals that she was deficient in. These consisted of magnesium, vitamin C, zinc, selenium, and iron. Her menstrual issues were resolved by using a progesterone cream and taking estrogen, and she was started on thyroid extract to help control all of her other symptoms. Okay, so this final slide is going to list her symptoms and try and give some of the causes for them. Her gluten intolerance resulted in gastric inflammation, which led to the malabsorption of iron, zinc, selenium, and other nutrients. The inflammation in her GI tract impaired her gastric function and impaired her intestinal mucosal integrity, which may have led to her development of Hashimoto's thyroiditis. Another contributing factor of this is selenium deficiency, which is caused by poor absorption due to the inflammation. High copper levels resulted from zinc deficiency and aggravated her depression and interfered with the normal functioning of zinc, vitamin C, and magnesium. LB's fatigue was caused by her thyroiditis, her gluten intolerance, which included the gut dysfunction, as well as iron deficiency, low magnesium, and excess copper. Her menorrhagia was caused by the hypothyroidism, iron deficiency, excess estrogen, and her progesterone deficiency and low magnesium. So when treating patients with Hashimoto's thyroiditis, it's important to treat the symptoms as well as the lab values. Just giving thyroxine will not take care of the symptoms. Gut inflammation needs to be decreased by avoiding allergens, such as gluten, and balancing bowel flora. Immune and liver function should be supported by supplementing, and hormones should be balanced, and thyroid insufficiency should be treated as well. The signs and symptoms of Hashimoto's thyroiditis are not just due to insufficient thyroid hormones. They're due to the deficiencies and excesses, all caused by the autoimmune-induced inflammation.
Okay, so this article studied the genetic and environmental causes of Hashimoto's thyroiditis. The exact cause is not known, but what we do know is that white blood cells, for an unknown reason, enter the thyroid gland, causing it to slowly die, which in turn causes a decreased thyroid function. They have found a strong genetic cause to this disease, especially in families and in twins. The environmental causes that are believed to lead to Hashimoto's thyroiditis are being a female, pregnancy, especially during the postpartum period, and this is due to the mother's body's hormones and immune cells returning to their pre-pregnancy state, which can cause the immune cells to attack the thyroid. Also included is an increased iodine intake, drugs, especially hepatitis drugs such as interferon, lithium, interleukin 2, which is to treat melanoma and renal cancers, infections such as hepatitis C and toxoplasmosis, as well as certain chemicals, specifically industrial strength chemicals. So the final outcome of Hashimoto's thyroiditis is the actual death of the thyroid gland. And this is because the body's infection killing cells attack the thyroid gland, which then kills the thyroid cells. Okay, so this article attempted to understand the genetic basis of Hashimoto's thyroiditis. It did find that based on family and twin studies, which we saw in the previous article, researchers have found evidence for a strong genetic component to the development of Hashimoto's thyroiditis. Specific inherited genes have been found, and this has been done by screening of individual genomes and by gene analysis in families and in twins. And those genes have been proven to lead to the development of Hashimoto's thyroiditis. The actual inheritance, like how you get it from your parents or how you actually develop it, or how actually develop it, is complex. All we know as of right now is that two genes need to interact in order for you to develop Hashimoto's thyroiditis. However, it's not known how those genes interact or how their interactions actually cause the disease. Besides those genes, researchers have found several different genetic risk factors that increase the chances of developing Hashimoto's thyroiditis. And unfortunately, at this time, although there is evidence to suggest so, there is no specifically known genetic cause of Hashimoto's thyroiditis. So basically, we know that genes are involved, but we're not sure exactly to what extent they are involved. Researchers continue to search for a genetic cause, and hopefully one day we will have an answer. Okay, so for the fourth article, Hashimoto's thyroiditis is the main cause of hypothyroidism. Hypothyroidism causes a decrease in thyroid hormones. The lack of these hormones can affect the entire body, and they cause non-specific symptoms. Because some patients without hypothyroidism have the same symptoms, it can be difficult to determine if a patient should be given thyroid hormone treatment if all they have are symptoms and an elevated thyroid stimulating hormone level. The most common symptoms that affect over half of the patients in this study were fatigue or tiredness, dry skin, and shortness of breath. Other common symptoms that were seen, but were seen in less than half of the patients, were mood swings, constipation, heart palpitations, restlessness, hair loss, difficulty swallowing, wheezing, and dizziness. So for the last article in this lovely little informative voice thread, Hashimoto's thyroiditis can cause a number of nutritional deficiencies. Most patients who have Hashimoto's thyroiditis are obese, and they say that losing weight can make the thyroid hormones normal again. The problem with this is that patients with Hashimoto's find it near impossible to lose weight, and this is because their bodies don't use the nutrients that they actually take in correctly. They're basically walking around obese, but they're malnourished at the same time. Hashimoto's causes abnormal glucose breakdown, which increases the risk of the patient developing type 1 or type 2 diabetes. Hashimoto's also causes gluten intolerance, similar to that you see in celiac disease. It also causes impaired digestion of food and improper absorption of nutrients from the food that the patient does eat. And because the body can't digest or use them properly, patients with Hashimoto's are usually deficient in protein, vitamins A, C, B, and D, as well as in minerals such as phosphorus, magnesium, potassium, sodium, zinc, copper, iron, selenium, and chromium. Patients with Hashimoto's thyroiditis are urged to increase their intake of protein, vitamins A, C, and D, as well as iron, zinc, copper, and selenium in order to help with the deficiencies, but also because vitamins A and D and the minerals zinc, copper, iron, and selenium have properties in them that help to reduce the inflammation or the swelling that is caused by the Hashimoto's thyroiditis, which will help reduce the symptoms.